we are going to continue to try to open up those ribs in that 360-degree pattern. Picture that umbrella that when you take an inhale in, your ribs come like an umbrella. They open away from your spine to the front, sides, and back. And then as you exhale, I want them to come back together. Don't leave them open. Okay, so we're putting our focus into your diaphragm and your ribs right now. Because if you can do that, then it takes some pressure off of this belly expansion. If that's the only way you can breathe, then you're not going to be able to hold it during exercise. Okay, so I like to do it this way just because it's quick and easy. I'm just going to remind you of the basics, and then we're going to build on what you already know. So you can put a pillow under your hips if this is too hard on your knees, or you can just sit on the floor, whatever is comfortable for you. But I want you to just do 2 to 3 breaths. You can always do more, but at least 2 to 3 breaths in each position, just really feeling that umbrella. So first, just sit with your hands on your knees, take a nice inhale in. See if you can get that umbrella, front, back, and sides. Forced exhale. Somewhat of a forced exhale, a long exhale, I should say, that dandelion breath. Feel everything coming in. Now big breath in. Good. Forced slow exhale. Feel it come together. I like to pause at the top and pause at the bottom just to really feel it, okay? You can even, if you can't feel it into the back, you can even push against your legs, round your back a little bit. Try a breath there and just see if you can feel that expansion, almost pushing your ribs backward. Like a cat, you're in that cat position. Okay, now 2 breaths here. Put your hand down, reach up and over. Now you're really feeling it opening over here. You can even come forward a little bit if that feels better for you, kind of reach on an angle. Do 1 breath there. Feel it into your shoulder blade. Good. This doesn't have to take you a long time. It's just a way of stretching your body, but we're using your breath. Feeling your ribs over here expanding with each inhale and exhale coming back. And then reach forward a little bit. Get in your shoulder blade. Good. You can do the same thing with a twist. Twist your body. Breathe in. Umbrella. Forced exhale, slow. And the other way. I have my hands here so I can really feel like, oh yeah, I'm doing it, umbrella. Keeping spine long. Okay, now I want to add on to what you were doing on your side to get that side, the lateral stability line. So come into a side plank position. This can be whatever works for you. I'm just going to keep my knees down. Of course, if you're strong enough and you can still hold your form, you can go up onto your feet. Right now, just for demonstration, I'm going to keep my knees down. I hope I'm not cutting off my head in the video because this is a quick little thing here. Okay, so I'm going to lift up, thinking about shoulder into its socket. Okay, make sure you're not scrunched up at all. Shoulder into its socket. You're puffing away from the floor. Your spine is in line, your hips are in line with your shoulders. And now I want you to put your hands on the bottom rib. I want you to feel that expansion, trying to keep some of that zipping up and in here. So we're expanding through here to breathe. Take as big a breath as you can. And forced exhale. Close everything down. As you exhale, you should feel everything tightening that I taught you through here. Finding that tension. Inhale again. All the way, keeping your form. That's the key. One more time. Shoulders are down. just breathing with intention into that umbrella pattern. So do the other side. I guess I don't have to really demonstrate both sides, but might as well just keep the video going. Okay, so you're up, your shoulders down. You can be up on your feet if you want to, but you're this nice, straight, away from the ground position, and then get your hands here so you can feel and expand those ribs as you breathe. It'll be less than when you're just sitting, right? Because now you're working. Try to do minimal belly movement. It's tricky and it takes practice, but I don't want all your breath going into your belly, especially when you're holding a position or you have a load in your hands and you're doing your weights, because then it's just going to pull on that midline. So come onto your hands and knees. This is what we're going to add on. And this is your plank position, although we're just going to keep it on hands and knees. Finding your neutral, so tip your pelvis a couple times and settle with your sit bones open to the back wall, and then bring your ribs up just a notch. So push into the ground, bring your head up, your ribs up so you're not sagging and you're not rounded, okay? Find that nice neutral. So you should already feel work here. So what I want you to do is breathe here. Don't let your ribs or your spine change its position. Inhale into the back ribs. Exhale, feel everything wrapping together. Umbrella. Now what I want you to do, that was 2 breaths. I want you to take your one leg, just hover it off the ground. So push into the ground to hover that whole lower leg. I don't need you to extend it straight. You can if you want to, but just hover. Same thing, hold your form and do your breaths. Now you can take it back. Don't sag your low back. Keep everything up, keep your lower ribs in. Take your breaths into your back body. Feel that tension between your hip bones in your lower abdomen. Same thing on the other side. 2 breaths with the hover. So hover, find your neutral spine again. Okay, make sure you're all in, all lifted. Hover that leg. Nice breath into the back body. Forced exhale like you're blowing out candles between your hands. And again. Then come out, arm up. Breathe into the ribs. Really connect on your exhale. Feel all that lower pelvic stability. Good. Okay. And then shift back onto your back. Now this can be what you were doing was, I believe, was keeping your, you were doing one leg at a time, some lifts along with a crunch. What I want you to work on now is still finding all that connection and bringing both legs up if you can, if you feel like you can still do it, keeping everything down, broad into the floor, feeling that tension along the midline. And then I want you to crunch up and just hold it. And the holding it just teaches your body how to breathe. So breathe again, neck is long. Breathe into those ribs. Forced exhale. On the exhale, feel all of this coming together. You can do this extended legs, bent legs, find your spot. But then I want you to take your arms over to the outside of your leg like you're holding a ball. Breathe. Keep your feet together, your knees together. I'm shaking a little. The other side, I'm sweating for sure. come on down. Another nice thing to do here, if you want a little bonus, is some of those rotations. I would hold something, a weight in your hands. I just don't have one nearby, but you can hold a weight. And then what I want you to do is letting your knees drop to one side and your hands, your arms drop to the other. So now we're like kind of unscrewing your body. Then I want you to exhale and screw it back together. Moving from, think about your hips and your ribs. This is the part like right at your belly button. If we took a cross section through you, that's what I want you to screw back together. So we're opening it and then we're closing it. So don't move with your arms or move with your legs, move with your hip and your rib. So you're gonna open and then, and here you should really feel like your low back is into the ground, right? Because you're using that whole stability system. You would go the other way. So really, again, you just need a couple times in each direction before you do your heavier weights, just to kind of get everything going there. You can also do this, if you can keep your form, you can do it here. So you're letting your hips go one way, and now we're moving from here and my opposite back of my ribs. Screwing everything back together. You can put a ball between your knees. Okay. The last thing that I want to show you is for you this handy dandy little self-massage ball. This is going to become really important at this stage, because if you have, think about on my shirt, if I have tightness in my back, in my obliques, in my transverse abdominis, and we're pulling like this, then it's pulling open that front, right? We need nice, supple tissues, so then when we wrap, we have room, we can bring everything together in the front. Same thing, you do a lot of lat work, so it's same thing with your lats, because they come down and through and integrate with your obliques here. So if you're tight through here, then you're going to be pulling on that midline, and tight lats are going to affect your shoulder mechanics, affecting your shoulder problem. So I'm going to add a separate video with a lot of things you can do on this to get your back, get your sides, but lats aren't on there, I don't think, so I want to show you. But if you lay down on your side, so this is a soft, these are the Miracle Balls. I love them. They come in a set of 2 and they're not very expensive at all, and Amazon sells them. But they have a nice give to them. So the goal is to let your body just melt over the ball. So if you get your lats are right under here in this base of your shoulder blade, kind of in this soft part here. So if you get that ball in that spot and then get pressure through it, you can work on, change the angle of your arm, find where you're tight. You can roll forward, you can roll backward, just change your position. You can even bring your arm up. Whatever works for you. When you feel like, oh my gosh, that is a tight spot, just pause and breathe and just get that muscle to melt over the ball. Okay, so that's your lats. You can move it down a notch and see if you have any tight spots in there. But just find, well, tight spot there. Just find your spots. Okay, the way that you do your back, it's in the other video, but I'm just going to show you super quick anyway. If you get the ball, so this area here that encases, you know, it is comprised of your obliques, your transverse abdominis. You can just get the ball kind of right under your ribs in the soft part there. And again, you lie down over it. You can figure out if you want your legs bent or straight. And then you can just kind of move along and find those tight spots, okay, all through. Then you would move the ball down a little. Same thing here. Just kind of feeling where you have a tight spot and where you could just melt over it. I even straighten out my bottom leg and I get the ball into the front there. When you were coming to your sessions here, we were doing a lot of work. Well, I guess I only saw you a couple times. We were planning on working through the obliques and the psoas there. You have a lot of tightness. So you can do that with the ball. You'll feel it. Just kind of get it in that soft part right in here. Just don't put it right on the midline. But then anything else you can do, as long as it feels right, as long as it feels right for your body. And then to get your back, of course you can do the ball anywhere along your spine, but I like to move it right on the side in that quadratus lumborum, this softer part here between your spine and your hip. Don't mind my children, you can hear them. And then when you're on, so you'll feel lopsided, but then when you take your leg up, you're gonna feel, you can kind of tip your pelvis a little bit around the ball, but you'll feel that ball pushing into that muscle. You can even bring your leg out a little bit, maybe tip your body to the side, whatever, again, you find the spots. Whatever works that feels like, oh my gosh, that is going to, it's pushing on something that is restricted. And then you just breathe and just stay there. Okay, so those are some progressions for you. Let me know how they feel. Please only do things that feel right in your body, that feel like they're not causing increased back pain, not causing any increased pelvic pressure. You feel like you can get an appropriate tension through your abdominal wall. If you don't feel those things, let me know. And then make sure we're working it into, continue to do all your CrossFit stuff, do that stuff, but you'll start to feel your body stabilizing differently as you start to get these ribs opened up. You'll use your core in a different way. So I hope you'll feel the translation into when you're holding heavier loads, when you're doing your squats and all those things. Just think about, with those, just think about your form. Think about where your ribs are, where your pelvis is, using the right muscles, taking your time to stabilize.